Patients may think that doctors don't appreciate just how hard it is to stay off their foot while maintaining their necessary daily activities and livelihood. Doctors may think that patients don't understand just how important it is to keep weight off their healing foot. Dr. Heidee Kalmar, a foot specialist with the DuPage Medical Group in the Chicago suburbs, recently experienced both views as she recovered from a broken bone in her foot. We had the opportunity to learn and share her insights and tips for both other patients and other healthcare providers.
The crutches they'll do in small, for small doses, but certainly if you have some things to accomplish, especially if you have small children, and taking care of my patients and being in the office, I was able to get around much faster than crutches. I'm not sore because of the crutches. I was starting to get very sore from using muscles I haven't used for a while. And so I really, I got the scooter pretty quickly, so I didn't have a chance to get super sore on my crutches, but I'll tell you, I noticed a difference right away. I found that it definitely freed up my hands so I could take care of things in my home, here in my office as well. 3 days.
Okay.
3 days, and then I knew that that's when I actually found out that I had a fracture. I thought I sprained my foot. Had come to my office and I diagnosed a fracture, and knew that obviously my treatment had changed then. I needed to really be non-weight bearing, so that's when I called you guys, because I prescribe it for patients all the time, and I know that I needed something to help myself get around, because crutches was very difficult. They were very difficult. Just not having my hands. I have 2 small kids, especially in my house, 2 small kids, and not being able to carry things. And so in the kitchen, cooking and things like that, I definitely used the basket, put as much as I could in the basket to get around my island in my kitchen, and it made it much easier.
Okay.
Much easier. Very life-changing, I'll say, because I couldn't do it on my crutches. They're surprised. I actually I have a pretty good relationship with my patients, and of course they see that I'm on a scooter. What happened. Rena was very good about taking care of that question for me, but when my patients would see me on the scooter, they're very interested. Many of them very interested, and several of them obviously needed this scooter, and it actually was probably helpful for them to see me on it, so they could see how it worked and then felt more comfortable, I think, actually getting it for themselves.
Okay.
Sometimes you prescribe it or you recommend it, and there's a little hesitation, and not really sure about it. We usually give them the brochures from the office so they have a little better idea of what it looks like and how it can help them get around. But seeing me on it, I think it was much easier for them to say, wow, I do see the difference. I see how you can get around a lot easier. I give them a little bit more detailed instruction, I think, because I've learned a couple of things about using the scooter. Just really making sure that the height of the seat is the proper level, so they can keep their back straight, not affect their knees as much. There's some patients who I think that if they do have knee issues, it might be more difficult for them to use the scooter, and you keep that in mind. So the height, and also the height of the handrails where you hold on to steer, making sure that that's appropriate level, and kind of giving them some ideas. The seat, you do have to, for left versus right. I had one patient come in, it was in the wrong position, and it was for the left foot, and I realized that it was, that was in the wrong position, so it was probably more difficult for her. I was able to change that for her because I knew that, which you don't necessarily know when you prescribe the device. But and the other thing I found is that it's helpful to tell everyone to be very conscious of what they're leaving on the floor, because obviously it's going to limit your mobility when you're on the scooter. So get everybody involved, and got to pick up after yourself, and keep the floor clear so you can get around easier. When you're using the scooter, put shoes on your other foot, protect it. Because I have run over my own toe backing up.
Okay.
On carpeting, I think especially because you have to push a little harder, and then if you lose your footing and your toe, jams into the wheel. Because sometimes people will skip the directions, but you guys were. The information that comes along with the scooter says, you really do want to read this. And I think that's important, because I think it was in a couple places where I was like, okay, I better read this. I better read up how not just assume I know how to set this up. And it was a minor thing, but it was important. If you're going to put a patient in a below the knee cast, definitely pad up that anterior crest. Make sure that there's enough padding so they don't have any issues with even, the padding is adequate on top of the scooter, but just the pressure of the weight of the patient being on the front part of their anterior crest. And if they use the scooter a lot, you just want to pad that up quite a bit. Make sure it's ample. The day I called, it's pretty much like the next day the scooter was on my doorstep. I was so happy with that because I was wondering how I was going to get around. And then even when I said I wanted to try the other, the hands-free crutch, that was there very quick. So very quick shipping. I think that's important. When people decide that they want to try it, if it's there quickly, I think that's very important. The cost is well worth it. It's well worth the device, and how much it frees you up and keeps you mobile. It even allows you to work in some instances. I think some people would actually. I was able to work. I have a full busy schedule. I was able to maintain most of it. So when patients, some patients will say, I can't afford it. I think in certain situations it may be very true. However, I would say that most people probably could afford to do this because it does allow them to still work or still have the freedom to get around. But sometimes it's a matter of just being off the foot. It doesn't have to actually be elevated, especially that first week after the injury, then they can elevate it nice and keep it protected, and then after that you really can start to get around a little bit more. That's where it becomes extremely helpful. How am I going to use this scooter? How am I going to get in and out of the rooms? That was my biggest concern, is how am I going to get in and out of the rooms? So I was actually able to still close the door. I just used it as my seat too when I got in there. So I didn't have a stool. I just sat down on my scooter and used it. And we took the stools out of the room.
So it is a seated scooter then?
It is, absolutely. Yeah, it transformed itself. I used it, like I said, to make my dinners and to make meals and get things for the kids. I would just, I'd use the basket quite a bit because I could pick things up easily and just put them in the basket and take them from one room to the next. And instead of having to just leave everything, where it is, because I'm not really good at doing that. And I couldn't pick anything up with my crutches, so it was really hard because things would get a mess. I have 2 small kids, so.